Hello, my name is Arjen, the founder at Back Pain Truth and the owner at the Ross Physio Clinic. In today's video we're going to talk about why common treatments don't provide lasting pain relief. Now, the first thing, just a little bit of a story. I mean, almost every single week I get one or more people telling me a very classic story. They're telling me they've been seeing a manual therapist like a chiropractor, an osteopath, a physiotherapist, and they've probably been seeing them for a number of years. And that's when they say that the first bells start to ring. Now, they all tell me that they used to go to see them maybe once every 6 weeks, once every 8 weeks, maybe a little bit longer in between. But eventually the frequency became greater. So in other words, they had to start to see them every maybe 4 weeks, every 3 weeks, every 2 weeks. But eventually the treatments they were receiving was not providing any benefit any longer. So there is a very good reason for that. And so when I'm talking about manual therapies, could be even, acupuncture, other types of treatments. But they all have one thing in common. And for me personally, I think where things are going wrong is that the treatment they are receiving is starting at the end. Now that may sound strange, so let me just clarify that. So to be able to really to clarify why most common treatments don't really provide lasting pain relief, maybe just let me explain it. First of all, why does back pain, sciatica, start in the first place? And it's always normally one common reason. Now, first of all, the back pain development stages, we call this stage 1, is unbalanced. Let me just use a different pen for this, because I don't think it's very clear. So we call this stage 1. And in stage 1, it's basically unbalanced use body. Sorry, this is a B. So unbalanced use of the body. So which basically means is that we all use our bodies in a certain particular way every day. I mean, for example, you may be sitting at your desk all day. Somebody may be doing a physical job whereby they bending, lifting, they're doing a lot of kind of bending activities day to day, or it may be something totally different. But at the end of the day, we all use our bodies in a certain way, and that is what I like to call an unbalanced use, because outside, let's say 7, 8, whatever many working hours, people don't often do things to try to compensate and do other types of activities that the muscles are being overused, are being used less, but muscles are being used less, are being used more. So try to get that balance. So that's basically where this stage 1, we also at some point that we then develop what we like to call, and that's when you end up in stage 2 of back pain developed, and that is muscle imbalances. So this is stage 2. So a little side issue with stage 2 muscle imbalance, because of unbalanced use, and we all to a certain extent at some point in our lives develop muscle imbalances. For some people that may be more so than other people, but depending on the extent of the muscle imbalances, that is why we eventually, because of the muscle imbalances, we develop what I like to call a physical dysfunction. So a physical dysfunction, which you develop because of the muscle imbalances. Now, on the one hand, it may be that your pelvis is pulled too much forward, which obviously with it will pull the lower spine too much forward. In other words, it causes an increased dip in the lower back. That's just one of the 4 main physical dysfunctions that I tend to see in the clinic mainly. Another one may be that maybe one hip goes just a little bit higher than the other hip, again caused by muscle imbalances. Yes, you would probably say for maybe somebody has a leg length difference, of course, you will look at that, but most people, they have some form of muscle imbalances, pulling one hip higher than the other hip. Now eventually those muscle imbalances will then lead, because you can imagine that if your spine, your body is pulled out of its natural alignment, then it causes incorrect excess stresses to be built on one, maybe various structures that will eventually break down. So once those structures break down, then maybe one day, it's a bit like what I like to call the scenario, the last drop it before the bucket overflows. In other words, so eventually something has to give. So one day, therefore, stage 3, you develop a condition. And that condition could be a disc bulging, for example. So in this stage, we develop one or more back pain conditions. And some of those back pain conditions, it may the pain be just in the lower back, other conditions, the pain may even refer down the leg, known as sciatica or pseudo-sciatica, but I won't go into that because there are some conditions that can cause sciatica type pain refer down the leg, but it's not really truly sciatica. So this is obviously stage 3 of the back pain development. And then eventually, because of this condition that you developed, we have the symptoms like pain, could be pins and needles, do it like this, could be numbness, whatever that may be. Yeah. So this is stage 4 of the back pain development. Stage 4. And so day to day, over the years, you have an unbalanced use of the body. Then eventually that causes muscle imbalances. If those muscle imbalances are bad enough, it will pull the body, the spine, and the pelvis out of its natural alignment, which then causes a physical dysfunction. So this is stage 2 of the back pain development. And then eventually something has to give because these incorrect excess stress is being placed on the spine, on the various structures of the spine. Something eventually has to give or break down, and that's where you then develop stage 3, like a condition which could be disc bulging, a herniation, could be something else, could be a simple joint locking. But hopefully initially in the beginning it will be what we call a simple back pain problem. Now I'll go into another video about how simple back pain problems can develop into a more severe problem, but that's for another video. And then eventually stage 4, we're talking about the symptoms. Now the real problem is, and what I said in the beginning, coming back to now, is that remember I said most common treatments, they start at the end of the treatment. Oh, sorry, at the end of the back pain stage development. So there, yeah. So most common treatments, they focus at the end. In other words, they focus on stage 3 and stage 4. They treat a condition. So common treatments start here. Yeah. So most common treatments, they start at the end. So they start at stage 3 and stage 4. So they treat the condition and treat the symptoms. And that's it. So you come off the plane and think, oh great, I can move. That maybe take a number of sessions. But eventually you say, oh great, I feel good again, I can move again. And you go back to your normal day-to-day life, your normal activities. But in other words, you are still functioning with your body and your spine out of its natural alignment. So those incorrect excess stresses will continue to play havoc at the background. In other words, this stage 1 and 2 has not been dealt with. So for treatment to be successful treatment starts here. In other words, to get lasting back pain relief, successful treatment, you need to focus on stage 1 and stage 2. And unfortunately, I hear this story in my clinic every week again. This is something that people always tell me is never been dealt with. Stage 1 and stage 2, they only get, and most common treatments focus on stage 3 and stage 4. So I've done a little short guide and with some nice step 1 to try to identify potentially if you have muscle imbalances yourself by using something simple as a mirror, or you can somebody just take some pictures from the front, the rear, the side. And so use a little guide. I'll put a link below the video, and I really advise you, if you're interested to find out or read, first of all, to understand more about this concept, the muscle imbalances, what I use every day in my clinic to help people dealing effectively with their sciatica and back pain. I put a little guide together, it takes 15-20 minutes to read. Please download that, have a read, and at the end, as I said, there will be step 1 to try to begin to identify your muscle imbalances. And I would love to hear if you have any questions about that, or just in general about this, or any questions about the guide, or you're not sure what to do, or you want to show me your pictures, or you want to whatever, share with me whatever you found, please do so. If you want to do it in person, if it's a personal thing, that I can totally understand, please send me an email, arjen@backpaintruth.com, or if you're happy to do so, leave a comment below the video. As I said, I'll put the important links, if you want to read a bit more, below the video. Have a read. Any questions, ask me. Please share this video to allow others to find this easier as well. There may be loved ones or whatever people you know could benefit from this information. So please share. Subscribe if you want to get a notification about my next video, which I'll be doing very soon. And hopefully I'll see you in the next video. Thank you for watching. Bye.